Hello, this is my attempt to summarize Apert Syndrome, and hopefully when you're done watching, you will know just a little bit more about it. Apert Syndrome is defined by the fusion of the skull bones during early development and webbing of fingers and toes. Apert Syndrome has no other common names, although there are scientific names to describe when the changes take place, because that there is for everything. What causes the disorder? Apert syndrome is caused by the FGFR2 gene change/mutation. It is hereditary and an autosomal dominant idea, but many cases result from a new mutation in a person without the disorder and family history, making it somewhat of a lottery chance disease. What gene/chromosome is affected? Apert syndrome is caused on a single gene by a rare mutation. This mutated gene is normally responsible for guiding bones during development to join together at the right time. The mutation of the Apert gene syndrome appears to be random in almost all cases. Only about one baby out of 65,000 is born with Apert syndrome. The physical signs usually analyzed/diagnosed at birth include a tall skull, a high eyebrow, immature upper jaw, noticeable eyes and intertwined fingers as well as toes. Finger and toe combination sets Apert syndrome from other craniofacial disorders, and basically what that means is that there are many disorders of the face. However, the finger and toe combination, how they connect, and makes it a little bit different from others that just affect the face or other areas. The symptoms include a cone-formed skull known as, I can't pronounce it, but it's right there. A face that is profoundly set in the center, eyes that are wide and swell outwards as a curved nose, and an immature upper jaw, which can make the teeth become swarmed in all cases. Who can be affected? Well, I mean, just about anyone can be affected, and that's because Apert syndrome is believed to be primarily caused by a mutation in a gene that is responsible for your bone development, and it is evident that anyone can become at risk for Apert syndrome while in development, so yeah, anyone can be affected. Is it dominant or recessive? Apert disorder is acquired in an autosomal dominant expression, which implies one duplicate of this modified quality in every cell is adequate to cause the confusion. And so if you're having kids and you pass it down, it is very easy to get it. But that is very uncommon for someone with this disease to have kids. Apert syndrome has no known cure, but there are treatment options. Surgery to correct the abnormal connections between bones is the main treatment for Apert syndrome. It is known that life expectancy is drastically decreased for those who have it, but with the right treatment of surgery and other help, it can make life just a bit more normal for you to live. As I said, there is no cure for Apert syndrome, and surgery and the right precautions done throughout their life can keep them healthy and be able to live the normal age of death. No, this syndrome is unable to be prevented, and that is pretty obvious for the reason that the cause is a random rare mutation of a gene, and there really isn't a way to stop this from occurring. However, if you have it, try not to reproduce because it can be hereditary as well and easy to be passed down because it's a dominant fashion. Can it be, and as I was saying, can it be passed down? Yes, it can be passed down. However, it is very rare because the children often don't reproduce for the reason that they don't want to pass it down and it's just not in their mindset. And if they do pass it down, it is very possible for their children to have it because it is expressed in an autosomal dominant fashion. Is there current work to cure it? Uh, no, because it is seen not very possible to cure. And life is becoming more and more normal for those who are affected due to the progression of surgery and treatment options. So, treatment is on its way, and who knows, maybe sometime in the future there will be a cure for said disease, but at the moment there is not, and there isn't much hope for so. That is my video on Apert syndrome. I thank you for listening if you have come all this way through. Maybe you learned a couple things and just how it affects everyone in the world due to 65,000 and one, or 1 in 65,000 being affected. Thank you.